Hello, my name is Ruth Ann Dorrell. I'm a Regional Inspector General with the HHS Office of Inspector General. The OIG has long studied the response of government and healthcare providers to emergencies, including emerging infectious diseases like COVID-19 and natural disasters like hurricanes, fires, and flooding. Last year, we compiled this information into a toolkit of lessons learned for healthcare facilities that you can find on our website. Depending on the nature and duration of the emergency, healthcare providers and their services and facilities can be profoundly affected. In this video, we will describe 6 lessons learned from our work as guidance for consideration in emergency planning at your facility. Lesson 1, leadership. Facility leadership must prioritize sustained preparedness. First and foremost, effective emergency planning and response starts at the top. It's critical for senior leadership to focus on sustaining preparedness over time, difficult as it is, devoting attention and resources despite competing priorities and not knowing what's to come, and building response capabilities into routine facility operations, into the daily work. As part of this, facility leaders should conduct routine self-assessments of their preparedness. The results of these assessments can provide useful insight with immediate effect and supplement and support compliance with federal requirements. And this should include all operations. For example, making time to routinely test for facility and technology vulnerabilities prior to an emergency, like a surge of patients, helps to uncover problems in a controlled environment without the risk, allows you to recognize opportunities for improvement ahead of the actual disaster. Lesson 2, staff must be fully trained in emergency procedures. This, of course, seems obvious, but with traveling staff and changing conditions, staff training can be missed. Ensuring that you have a trained staff is a critical element. Frontline staff will be better prepared to respond when they have received advanced training on plans and requirements. And a few specific things to consider as you're building this out. First, being comprehensive. Facilities should conduct training across departments, including both clinical and non-clinical areas and staff. Using this approach of working across departments creates opportunities for all staff to learn from each other and to understand the needs of other areas and roles. This also helps to identify and address any potential gaps in roles and responsibilities during an emergency. Second, new staff. Emergencies or other special circumstances may require that new or contracted staff fill needed positions, will likely require that. And those newer contracted staff may be on the very front lines, but without the core knowledge of the long-standing employees. In this case, it's important to both adequately train and closely supervise any new staff to ensure the highest quality patient care, to ensure compliance with proper protocols, to make sure everyone understands both the routine and the emergency practices. And last, you may need additional support to your staff. During emergencies, facilities may need to provide housing or help make connections to daycare. There may be emergencies that disrupt transportation or require staff to self-isolate and are not able to work very effectively unless we provide these additional services. Lesson 3. Establish effective and ongoing coordination and communication outside the facility. Ongoing coordination within the community, within government, other providers, vendors, all of the stakeholders can make a huge difference. Specifically, the ability to tap entities who are tasked with emergency preparedness as their chief mission, such as local first responders, fire departments, and also healthcare coalitions. If you're not familiar with healthcare coalitions, they are member-led organizations that are composed of healthcare and other community entities that voluntarily work together to coordinate an emergency response. The HHS Assistant Secretary for Preparedness and Response, ASPR, supports healthcare coalitions through the hospital preparedness program. Typically, a healthcare coalition consists of 4 core member types: hospitals, public health agencies, emergency medical services, and community emergency management. These 4 member types can include other entities as well, such as long-term care facilities like nursing homes, home health agencies, anyone who is responsible for a vulnerable population. Together, these groups are critical to addressing the unique preparedness needs of communities and developing a collaborative response that includes the ongoing coordination of shared community resources, such as transportation, utilities. Pressing needs for these resources without prior coordination can lead to delayed care for your patients and to enormous stress on systems, on providers, and of course in the public. There are also opportunities within healthcare coalitions to share other obligations, messaging to the public about what to do in an emergency, where to go. In addition, coalitions can create opportunities for use of existing networks that will maximize resources in your learning. To learn more about how healthcare coalitions work, we have a companion video regarding roles in community emergency planning. This outside coordination by facilities should also include establishing effective relationships and timely communication with all of the government partners, including CMS and state government, who can provide guidance to your facility during a crisis about how to maintain quality services and how to maintain compliance. Lesson 4, protect facility data. Effective management of facility data can deeply affect patient care during emergencies and has grown in importance as facilities have become almost entirely reliant over the past decade on electronic health records. Facilities should ensure the ability to access electronic health records during and immediately after the emergency. And to do that, it's essential that the facility emergency plans account for that ahead. Specific information about how to share records across facilities to ensure access to expanded and temporary facilities. Developing system redundancy, such as an off-site secondary data storage. All of these things can be vital to patient care. Making sure that we make informed patient care and emergency decisions, ensuring proper payment and oversight after the emergency, protecting patient privacy, and coordinating resources to maximize quality of care across the community. Lesson 5, pay attention to post-emergency recovery. Facilities should plan ahead for that post-emergency recovery phase. When you talk to the old hands who have faced all varieties of dire circumstances, one of the first things they tell you is that the emergency is not over when the storm has passed, so to speak. The operations continue, usually without pause, from emergency to routine operations, and sometimes back again. It's useful to plan ahead to direct your post-emergency recovery efforts to help you to get back to standard operations, to build that bridge back to normal as soon as possible. This might include practical matters such as restocking supplies, restoring systems, reconciling the books with entities that helped in the recovery. It could also include conducting postmortems, post-emergency response reviews that seek new lessons learned to help you for the next problem down the pike. Lesson 6, scope your planning to encompass multiple scenarios. Our final key for healthcare facility response is perhaps the most challenging, and that's determining the scope of your emergency planning. With competing priorities and with substantial differences in the types of emergencies and their resulting needs, an emerging disease versus hurricane, it can be difficult to know what to focus on. In talking with emergency managers all over the country over the years, we support an all hazards approach to emergency planning. All hazards accounts for the most likely possibilities, while also ensuring that you're not left high and dry for more extreme situations. The topic of all hazards preparedness from a practical perspective is explored in more detail in a companion video that looks at CMS emergency preparedness and their embrace of all hazards planning. In closing, sustaining emergency preparedness over time includes, number one, leaders who prioritize those efforts. Number two, effectively training staff. Number three, protecting data. Number four, promoting communication and collaboration across the community. Number five, paying attention to the post-recovery phase. And number six, scoping planning in a way that accounts for all hazards. Our respondents over the years have indicated that these factors can make a substantial difference in mitigating consequences and improving your outcomes during difficult times. I wish you well. Thank you.